Hi friends, my name is Nandita. I am from Andhra Pradesh.
Good morning dear students. Today we are going to discuss about excretory products and their elimination from chapter 19 CBSE syllabus class 11. Urethra. Urethra, it is a tube-like structure that arises from the urinary bladder. The urine comes out of the body finally through this. In males, this is common path for sperms and urine. We can understand the urethra has the thin tube or a duct that interlinks the urinary bladder to the urine meatus so that urine can pass out from both males and females. The urethra function is only for urinating in females, but males use this urethra for ejaculation and urination. In other words, the male urethra transports both urine and semen. The female urethra is about 1 to 5 inches long and the female urethra is long as penis, through 7 to 8 inches in length. The urethra is held by the urethral sphincter, a muscular structure that helps keep urine in the bladder until voiding can occur. Now that we have touched the base of the urethra function, let us devote into its other nitty and gritty. Urinary bladder is a Urinary bladder, a slag-like structure which stores urine temporarily. The urinary bladder has two parts, body and trigone. Body is made up of involuntary muscles, which is called distressor muscle, and trigone is a triangular part. There are two sphincters on the lower end of trigone. Internal sphincter made up of unstraighted muscles, external sphincter made up of straighted muscles. Urinary bladder has capacity of 700 to 800 ml. When it is filled up to 300 to 400 ml of urine, then stretch receptors present on the walls of urinary bladders are stimulated and impulse is formed. This impulse is carried out to spinal segments through pelvic nerve. Parasympathetic nerve fibers are excited and contraction in distressor muscle and relax in internal sphincter occurs. This causes urine to come out called micturition. Lower part of the urinary bladder is joined with urethra. The primary urethra function is to let the urine pass from the bladder out of the body. It happens when the brain tells the bladder that it is time to squeeze and the splinter muscles relax, releasing the urine through the urethra. Likewise, the exact mechanism is also used in case of male ejaculation during copulation. When male ejaculate, the sperm is carried throughout the urethra. The primordial differences between urination and ejaculation is that in the latter, instead of the brain bladder sphincter muscles communicating, when men have nerves in the spinal cord, vast differences, seminal vesicles and prostate that work in conjunctions to close the opening of the bladder. They work together to enable the semen to move down the penis and through the urethra. Let us explore the anatomy of the urethra. Urethra anatomy. Come to discuss about male urethra. It is divided into four parts as per the location. The first part is the pre-prostatic urethra. It is the main intramural part of the male urethra, engulfed by the urethral sphincter and ranges from 0.5 and to 1.5 centimeters in length, depending upon the fullness of the bladder. After that, we have the prostatic urethra. It starts at the neck of the bladder and it is located in prostate. It is the widest part of the urethra and it is surrounded by the sphincter muscle that holds the urine until its due time. After that, the spongy urethra makes up the bottom portion of the urethra, which has several subdivisions like the bulbous and penile urethra. The penile urethra is the most extended section of the urethra and runs from the urogenital diagram to the penis top. It is noteworthy to highlighted that all the parts of male urethra have their supply to arteries that facilitate blood flow. The prostatic urethra utilizes the inferior vesical artery. That membranous urethra uses the artery located at the penis bulb. The spongy urethra utilizes the pudendal artery found deep in the pelvis. Now let us discuss about female urethra. To begin with, the female urethra anatomy is far more straightforward than its male counterpart. The female urethra covers less distance and hence it is less complex. It starts at the bladder and parallels along with the pelvic floor. It opens onto the perineum after passing through the sphincter muscle. The female urethra comprises three layers: muscular, rectile, and mucus layer. The female urethra, as we have already mentioned, is about 4 centimeters long, exits between the clitoris and the vagina, and extends from the internal to the external urethral orifice. Human urethra. To begin with, the length of the urethra varies across genders. The length of female urethra is usually around to 4 to 5 centimeters, as we discussed earlier, whereas the male urethra is 20 centimeters or longer. The job of the female urethra is solely to facilitate urination. On the contrary, the responsibility of male urethra is urination and ejaculation. The voluntary control associated with urination comes from the striated muscles known as the external ureter sphincter. The urethral cancer is a rare cancer type found only among 1 or 2 people diagnosed with cancer.